Hi, I'm Dr. David Hill, and today we're going to talk about treating a runny nose in an infant. Now, infants almost always get runny noses as a result of a cold, although gastroesophageal reflux may cause congestion on a runny nose as well. Older infants, greater than 6 months of age, may also have allergies. So how we treat a runny nose depends in part on what the cause of the runny nose is. Assuming it's a cold, there's not a whole lot to do. The real thing to be concerned about is the congestion. When infants eat, especially if they're nursing, they have to breathe through their nose while they're eating. So an infant whose nose is clogged up may have a very difficult time eating and, of course, sleeping. The thing to do for this is to use saline drops. Now, you can go buy a product like Little Noses, a commercially available saline drop for very little money, or if it's the middle of the night, you don't want to go out to a drugstore, you can make your own saline drops. To do that, you take a half a teaspoon of salt in a cup of water. Go ahead and boil that to make it nice and clean and make sure the salt is all dissolved, and then let it cool back down to room temperature, at least to body temperature. You can then take a medicine dropper or eyedropper and drop just 2 or 3 little drops of salt in the baby's nose. Let them sit there for a few seconds, and then hopefully you still have that little suction bulb thingy that they gave you when your baby was born. Usually they're light blue or dark red in color. They came home from the hospital usually, but you can buy them at a drugstore for a couple of dollars if you don't still have it. And you can suck out the baby's nose using that bulb suction. Here's the key. The holes of the nose go straight back. They don't go up. So when you're sucking out the nose, don't suck up. Suck straight back. You don't have to jam that thing way down into the baby's face. You just get it right here at the opening of the nose. That's plenty. And you can suck out some of the snot and some of the salt water that you've made, and that'll clear up the baby's nose and usually help with eating and sleeping. Now, this can be overdone. First of all, it makes babies mad. You'll notice he or she is probably going to cry pretty vigorously when you do this. Second of all, if you jam a suction bulb in the nose a lot, you may make matters worse by causing more swelling. So I'd be pretty cautious with this. Do it just before feeds and before nap time or sleep time for the baby. Other than that, you might run a humidifier in the room so that the mucus secretions remain moist and mobile and don't dry up inside the nose. And you can always take the baby into the shower or use a vaporizer for the same purpose. Now, if the baby's runny nose goes on longer than 10 days, you may actually be looking at a sinus infection or allergies, especially if your baby has a fever that lasts more than 3 days or that goes away for 24 hours and then returns. In any of these cases, you really need to talk to the baby's doctor about a more thorough evaluation. Talking about how to treat a runny nose in infants, I'm Dr. David Hill.